Hello everyone, welcome to today's podcast, Talking Health, where we delve into an important issue that affects the lives of very many people in our region and in our communities. Our focus today is on reducing unintended pregnancies and unsafe abortions in the landing sites. We have a panel of experts here. Let's introduce them, let's meet them. Our first guest is Chedikol Enoch, a health worker. He's a health professional working directly in the landing sites. Our guest number 2 is a community peer mobilizer, Annette Ninsima. She's a representative from the local communities who actively engages with the communities. She advocates for better reproductive health care. Then our third guest is Nyashonji Simon Peter. He's a finalist at Nkumba University doing journalism and public relations. He has been involved in youth-led initiatives related to sexual and reproductive health in the landing sites. So, first of all, we want to understand the situation in the landing sites. To begin, Enoch, could you please paint us a picture of the challenges you encounter in your work regarding unintended pregnancies and unsafe abortions?
Thank you, moderator. Enoch has said earlier. Looking at the topic of today, I am really excited to discuss what is going to happen today. Looking at the landing sites, when you look at the landing sites, you find that there are few facilities that are offering sexual and reproductive health services in the landing sites. You look at, when you enter inside there, you get drug shops, not even clinics. So to add on that, we have people that are not experienced to handle these reproductive health services. Not only that, we have a lot of myth and misconceptions regarding reproductive health services in the landing sites. So basically, we have come as a team, as a family medical point, to address these issues, to make sure that reproductive health services are offered without any discrimination.
Oh, thank you, Enoch. Now let's turn to Annette. Annette, gwenga akola mu community, ndowooza kizoolaba abantu ze balina ezikwatagana ku zino ensonga z'okugyamu embuto mu bukyamu n'okufuna embuto abantu ze bateetegekedde. Ndowooza ki abantu ze balina?
Nza mukyala Poyoni. Endowooza eziri mu field eyo oba ku myalo gye tutambulira, abakyala be tusanga ntwogerako nabo, abamu okubeera nga bakozesa amadagala amaganda okuggyamu embuto baba tebeesobola kufuna ssente ze batwala mu maddwaliro okusobola kukola kyate tebaba na busobozi. Oluusi bafuna abasajja ne bajja ne babakozesa ne bafuna embuto nga tamanyi taata wa mwana w'abeera, so olubuto olwo n'abeera nalwo n'atumibwa okufuna eddagala egganda ng'ennanda ng'eyo oba ng'ebiti bya muwogo, so ne bakozesa eddagala egganda eryo ne bafuna okukosebwa mu bulamu. Olumu abamu bafa, olumu ne babaddusa mu maddwaliro nga tebasobola kufuna support y'abasawo olw'obuteesobola.
Tweyanziza nnyo mukyala Annette. Kati, we are going to listen, or would love to hear from our youth representative, Simon. What are some of the major challenges young people face when it comes to accessing sexual reproductive health services? But first of all, would like to hear about your involvement in these youth-led initiatives.
Thank you very much, Paula. First of all, just as she mentioned, I'm Nashonji Simon Peter. In 2011, I started up a Rotary Club called Entebbe Airport. And 2015, another Rotary Club called the Nkumba Stewards. And the focus was to see how we can mobilize youth involvement into issues that affect us. People think this is a white perception, Western perception that we should be using condoms or contraceptives.
Okay, thank you very much, Simon. We always hear about overcoming stigma and misconceptions. How do you, as experts and advocates, address and overcome these challenges while promoting awareness and education? There's a lot of stigma and misconceptions around sexual and reproductive health issues. How do you maneuver as experts and make sure people in these communities still get information? I'm going to hear from all of you, but then let me also translate for our dear Annette. Annette, tonga twogera ku kusosolebwa okuli mu nsonga zino. Mujjawo mutya mwabagenda mu community, mujjawo mutya okusosolebwa n'okujjawo stigma ono eyetoolodde ensonga ezo. Nza tutandike naawe.
Nza mukyala Paulina okumpa omulundi ogwokubiri. Bwe tutuukayo mu field abakyala ne batunnyonnyola ensonga ze bayitamu okuba bannaabwe babasosola, kubanga bwe tumobilizinga tusangamu abalwadde b'akawuka ka mukenenya. So bwe tutuukayo nga bannaabwe babasosola kati omutima nga baayekyawa, ne tubasomesa, ne tubakansolinga, ne tubawa kansolinga, ntulabika nti nabo tubagamba nti muli bantu. Ate ntubanyonyola ntubagamba singa oba otandise eddagala n'ogendera ku mitendera era tojja kubeera kiri kyokola ki, era ne tukwatagana nabo kubanga Family Medical Point ekolagana ne Tasso Uganda, ne tusobola okukwatagana n'abasawo ba Tasso era ne tubakonectinga nabo ne bafuna obujjanjabi, era mulimu abatukubira nga batwebaza era betusanga oluusi nga kiri kyabavaamu kubanga olw'okufuna kansolinga ennungi, kubanga abamu babeerayo nga tebafuna kansolingi, nga tebafuna babakola ki, nga bannaabwe babasosola.
Twenza nnyo Annette. Enoch, how do you address stigma and misconceptions surrounding unintended pregnancies and unsafe abortions?
Well, thank you. For us, for me as a health provider in Family Medical Point, how to overcome stigma, or how I have overcome stigma, because stigma is in two ways. It can be a health worker being stigmatized, and then also it can be the people that are seeking for the services that can be stigmatized. So, once someone comes, maybe like for example, I've got a lot of cases of women that come seeking for post-abortion care. You find most of them come to the facility when they've already induced the pregnancies, and then we have to dive in and help the situation. Maybe you find that somebody has bled a lot and it's anemic, and if you don't handle, someone end up losing their life. So what we do, we try to make sure that we are not like others. We are not like other medics. We make sure that we don't judge these people. We give them the service that they need. That is one step that we have taken. So once you come into our facility, we take you through counseling so that you make an informed choice regarding family planning and post-abortion care. So you have to go through a comprehensive counseling so that you come up with an informed choice. So that when you get a service, you know what to expect and what is going to be done to you. So those are the steps that we have come up to address this. Not only that, we also have peer mobilizers. We have recruited peer mobilizers in different landing sites. These people, they go down into the grassroots, and these are the people that are already well known to them. So you find that it's easy for them to talk to those people, and those people bring them to us. In that situation, you find that they are not stigmatized, and they don't feel shy.
Oh, thank you, Enoch.
Thank you.
We have an issue of cultural sensitivities and local practices, and Simon here had mentioned something related to it in his introductory statements. How do you navigate the cultural sensitivities and also respect local practices while promoting sexual reproductive health practices? Can hear from you, Simon.
Of course, we also or maybe to just drop something small on stigma. The biggest threat to this kind of conversation is a stigma. Every time these young girls say get these challenges, their biggest worry is who do I share with, and how, if they know, will they push me away? That's the biggest threat, and I'm happy that Dr. here is finding a way of approaching it. Of course, we should not forget that whatever we do, we live within a cultural setting and religious setting. And some cultures, for example, the Bagisu will tell you the moment a man is circumcised, they are man enough. Yeah, there are certain things that we don't need. You are man enough, implying you can even conquer diseases as long as you're that sharp. Okay. So there is also other stereotypes of course, still under culture, where some women will frankly tell you, for us, we don't use contraceptives, and in a way, it affects them in long run, because when they get pregnant, they'll be thrown out of school, and it affects them in the long run. So how we approach this is basically coming up with the youth-led initiatives like Rotract. Rotract is basically youth between 18 and 30 years. Yeah. And every time these young people see a fellow getting involved in information that affects them, they easily allow them in and pour out their challenges. And it's one of the ways that I think it's working. I'm happy that when these Rotractors get to landing sites, they're able to do HIV testing, counseling, and when they involve these young people, in that way they're addressing the whole issue. Thank you.
Thank you, Simon. Muchala Anit, ku myalo eyo mba mugenzi okusomesa abantu wali abakyala abagana okozesa family planning nga bakozesa nga bagamba nti nno tekikwatagana na buwanga bwabwe. Ezo ensonga gye ziri?
Ezo ensonga we ziri. Kubanga waliwo wotuuka n'osomesa ku family planning n'akugamba nti family planning ereeta ebizimba, ereeta ki, so nakugamba ye tasobola kukola ki kukozesa family planning. Naye ffe tutuula naye ne tumusomesa ku family planning, ne tumugamba katukutwale mpola tutuukewo omusawo akusomese, kubanga family planning zino muziwulira ku banibolo bwakugamba nti empisi za bubi, kitegeeza gwoba takola ki, tejja kuyisa bubi. Tugenda omusawo ajja kukebera omusayi alabe gurupu yo gy'okusobola okukozesa osobole kufuna family planning, oleke kuzaala abaana b'oteetegekedde. Kubanga mwe tutuuka mu family mu abantu mu field batugamba oluusi abasajja babasuulawo olw'okuzaala, era n'abasajja tubasanga ne batugamba abakazi batulemeredde kubanga buli mwaka azaala. Musawo nyamba ogenda mu counseling omunnyonnyola kole ki, bangi abasajja babasuulidde abaana ne bafuna abakyala batalina ki, kubanga obusobozi buba bungi ng'ate omwami takola ki, tabisobola.
Tweyanziza nnyo Anit. Enoch, yes. Can you tell us about the availability of family planning and reproductive health services in the learning sites? What are some of the strategies to ensure more comprehensive access that you've taken?
The strategies that we have taken to make sure that family planning and other reproductive health services are available in the various landing sites. One, we have recruited different facilities in different landing sites, at least one per landing site. And each facility has a peer mobilizer, and that peer mobilizer will be going deep into the population and referring these people that need these services. They go door to door, speak to people, hear people's problems and the challenges. They refer them to the focal persons in the facilities, and those focal persons in the facilities refer to us and communicate to us. And in case of any challenge, we come and address it. Not only that, we also have what they call Musao session that we always conduct once in a while. where we go deep down in the facility, I mean in the community, we hear what people are, the challenges people are facing, and we address the misconceptions, the myth that people are having. I tell you, people are having a lot of beliefs about family planning, about post-abortion care. People have a lot of beliefs. But when you go deep down in these people and listen to their cries, we always correct them, and we always make sure that we do our best to make sure that these people get the services that are recommendable, the services that can correct the myth and misconceptions.
Okay, thank you, Enoch.
We also, lastly, we also supply these various facilities with supplies, and we do mentorship always on the health workers that are working in these facilities. Thank you.
Thank you, Enoch. As we sum up all this, how are we going to involve men and boys in this work and to make sure we reduce unintended pregnancies and unsafe abortions? I would like to hear from the men first. Within just like 30 seconds, tell us how can we involve men and boys?
First of all, we must accept as men that whatever challenges a girl child or women go through affects us indirectly or directly. Some of us are products of unwanted pregnancies, and we know the challenges that come with all that, and we wouldn't want to encourage this. So we must take responsibility, think of contraceptives. Also, don't throw the responsibility to women. If there is a necessity for us to use condoms, please, let's take responsibility.
Yeah, thank you.
Yeah, he has spoken the big part, or the main part is awareness, and of course challenging the cultural norms and beliefs. Some cultures believe, not even some, but most cultures believe that it is the work of a woman to control the pregnancy. But in actual sense, it's a combined effort between a man and a woman. When you have sex with a woman, you have to know that the likely outcome is pregnancy. And to stop this pregnancy, the two of you can stop it. As a man, I can buy an emergency pill for the woman, so I get involved in this. I prevent the unintended pregnancy.
Yeah.
Thank you.
Annette, abasajja tubanyigiddemu tutya wano mu butikitiki nga 3 oza tuyinza kubinyigira mba kyabasajja.
Abasajja ekireeta okubasomesa nabo ku family planning eyo, abasajja bali eyo, abasajja bangi tebalina busobozi, emirimu gyabula. Kitegeera bw'onoozaala abaana bangi, kitegeeza abaana bo ojja kusanga balonda scrap. So abasajja nabo baagala nnyo tubasomese ku family planning. Kati bw'aba agenza ow'omukyala ng'oyo nannyo nga banyeekolera jjange, aba alina okwambala kubanga abamanya ebiddirira bikola ki? Ate abafumbo bwe tumusomesa asitula mukyala we n'amuleetera ddala ew'omusawo n'amanya kituufu agifunye. Kubanga waliwo abakyala batakola ki? Abatakozesa family planning.
Toyanziza nnyo, Annette. Thank you, our esteemed panelists, for sharing your valuable insights with us. To our listeners, remember that change starts with awareness and action. I remain Nawire Pauline. See you next time. Peace out.